How stem cell therapy works, your path to pain-free living. Hello, I'm Josh with DreamBody Clinic, and we are a clinic here in Puerto Vallarta, Mexico that offers mesenchymal stem cell therapies. We get asked a lot, how do these work? What are the different things they treat? I'm just going to go through that real quick, give you an overview. You can always go to our website at www.dreambody.clinic. It's got all the information, links to studies, prices, info, testimonials, everything's there. So, stem cell therapy. Mesenchymal stem cells are called stem cells, but you have to go back to how they were discovered and what we found about them. So Dr. Arnold Kaplan, so early 1990s, he's in the lab at Case Western University. He found these cells. They live on the outside of capillaries, and he's playing with them in the lab. Now, at this time, they're called pericytes. They're still called that, but we're going to get to how they became mesenchymal stem cells. So he's playing with them in the lab, and he used to joke, he'd say that he could make them dance. And what he meant by that is he could turn them through some basic manipulation into different cell types, like a chondrocyte, a building block of cartilage, an adipocyte, a building block of fat. There are like 4 or 5 different cells. You've got like bone precursors, cartilage precursors, a few different things. So he finds that out and he goes, well, they're a stem cell. We can turn them into different cells. Then they start doing more experiments with this. They start putting them into animals and then eventually into humans. And what they found is that in the body, they don't differentiate, meaning they don't turn into these different cells, these building blocks. They actually work via what's called the paracrine effect. So it's the signals they send out. They are like the manager on the construction site, barking orders to the workers, telling them where to go, what to do. So because of this, he's like, oh, well, maybe they're not stem cells. He tried to change the name of MSCs, the acronym, mesenchymal stem cells, to instead mean medicinal signaling cells. Unfortunately, the name just never caught on. The stem cell moniker was stuck, and that's where we're at today. So either way, you get the benefits you're hoping you would get from stem cells, but they do it in a little bit different way than people are expecting. And this is actually a really good thing because stem cells, like people think of these pluripotent stem cells that are typically from like aborted fetuses or such things. The problem with those is they want to become a baby. So they typically become what are called teratomas. These are tumors. They're not safe. The state of California spent like $2 billion researching this, never got it to work. In fact, they used the last bit of funding they had to research mesenchymal stem cells, which does work. So with these, we can treat a few different things. The most common thing we treat are joints. We treat a lot of knees. It seems like everybody's knees go at some point, become arthritic or a meniscus tear, or maybe your ACL has damage. These are the most common things we see. Very easy to treat. We put an injection into the knee. We use 50 million mesenchymal stem cells, and they get in there and they start seeking out inflammation. They're attracted to that. They're smart in this way. They will go to the damaged area and they will start guiding that repair process. They're going to help you heal like you did when you were a little kid. They do this via the signals they send out. They originally called them extracellular vesicles. Now the term exosomes has gotten very popular, and that's what they send out. An exosome is a single payload delivery system. The thing is, there's over 1,000 different types of exosomes. So you need to know which ones to send. So exosomes by themselves don't have that capability. They're like a peptide. They're free floating. They can help out. They're very useful, but they need to be recruited by the right tool to do the work. Where mesenchymal stem cells, they will go in and they will send the exact one that they need. Maybe an area needs some inflammation to tell more growth factors to go there. Or maybe a growth factor, very specific, needs to be recruited to go in and do the job. They will send those signals to make sure that happens. So you really need these managers where the exosomes by themselves, they're a great workaround to US laws, but not nearly as effective, and you don't get nearly as many. So by putting the stem cells in, they're going to guide that process. They're going to first get rid of any scar tissue, because the way the body heals as we get older is that you get injured, say your knee's hurt, you've got some bad arthritis, it starts grinding. The white blood cells get in there and they can only heal via fibrosis. It's a patch-up job. So they're going to patch that up, But now the problem is the growth factors in your bloodstream that would normally go and heal the cartilage or heal the meniscus or the ligaments or tendons, whatever is damaged, they can't get to that tissue. So they're stuck. They run up against all this fibrosis. They can't do anything. The stem cells get in there. They guide the removal of that scar tissue. Then they guide the regeneration of that tissue. And the cool part is it's real regeneration. If you've got arthritis, we can get you more cartilage back. If you've got meniscus tear, we can heal that meniscus. Your ligaments torn, can heal it. The first thing I ever treated was multiple tears on my meniscus and a partially torn ACL. I've got the before and after MRIs on the treatment page. If you go to the website, it's there. And you can see in real time how this goes in and heals those sort of tissues. And once they're healed, they still stay healed. I did that treatment 8 years ago. My knee's still good. So this is long-lasting stuff. So we can do that for shoulders, for your back, for ankles, elbows. We see a lot of golfers and tennis players come in with tennis elbow, a golfer's elbow, and it works incredibly well, helping out ligaments and tendons, helping out with arthritis. So that's the most common thing. And then the next thing you see is, well, I guess knees are number one, lower backs are number two. We see a lot of herniated discs, a lot of compression of the spinal cord, helping out with sciatica. So they do wonders for nerve pain. This is another thing I've dealt with. I had really bad sciatica 4 years ago from a herniated disc. We put cells in my back plus an IV, and within 10 days, all that sciatica was gone. And that's not because we fixed my herniated disc that quick. That took about 3 months. But we were able to reroute those nerves around the impingement. The stem cells get into the area where nerves are at. They'll send out what are called neurotrophic factors. These guide the neurons to regenerate those nerves. And here I was like barely able to sleep, feeling horrible, constant pain. And 10 days later, it was gone. It's never come back. And I've tried to hurt it again. Dirt bikes, jet skis, four-wheelers, all kinds of dumb stuff. And it's held up. So these are long-lasting results that can help you get pain-free. So pain is probably the number one thing that stem cells help. The next is autoimmune conditions. So stem cells have a profound effect on the immune system. With your immune system, sometimes as we get older, it stops working right. Now I have my theories. I think there's a lot of stuff they're spraying on food now that's causing a lot of these issues. I think you might have some issues with some of the GMOs, but that's speculation. It doesn't really matter what causes it. At the end of the day, if you've got rheumatoid arthritis or ulcerative colitis or multiple sclerosis or any other autoimmune disease, your immune system's not working right. It's attacking your body when it should be protecting it. And we need to fix that. When you put stem cells in the body, usually via an IV, goes through your system and it interacts with your immune system. And what it does is it sends out these specialized cytokines. And what they do is it's like hitting the factory reset button on your immune system. They take the T cells, the B cells, the natural killer cells, all these different immune cells, and reprogram them if they're not working right. They're going to get them back to that factory setting at the start to start protecting and stop attacking. So what that means, if you've got rheumatoid arthritis, well, the IV is not going to do much for your arthritis because cartilage gets very little blood flow, but we can stop the body from attacking. That relieves inflammation and pain. The body can start healing. Ulcerative colitis, that means we're going to help your gut. We're going to stop all that bleeding, all the inflammation, all the problems, because your immune system is going to start protecting your intestines and your gut. For multiple sclerosis, it's going to stop attacking your spinal cord or your brain. It's going to start protecting. Now we go a bit further. In that case, we actually go intrathecally, which is into the spinal cord fluid to get it straight to the brain. And we're seeing spinal cord lesions and brain lesions heal. You can see those before and after MRIs on our multiple sclerosis treatment. And that's just 3 of countless autoimmune diseases that we treat. Typically, the IV is the main thing. Certain things we have to go direct. So MS will go to the brain. If you've got Hashimoto's disease, we actually go to the thyroid, quick, easy injection. It sounds painful, but I've done it and really doesn't hurt. Super tiny needle. So we've got different things to go after. We want to take care of the inflammation. We want to take care of the repair, but mainly we want to fix that immune response, because if nothing else, we want to fix that to take care of the problem. And these results tend to last. I've got patients from 8 years ago that are still in full remission from autoimmune diseases. So it's pretty awesome for that. And the next thing that we go after is we see a lot of chronic degenerative issues. This would be like people that had a heart attack and their heart's not working well, or they have congestive heart failure. Their ejection fraction is getting low, and that gets scary because your only option is to get a heart transplant, and that's if you qualify. And, you know, if you're a good candidate, there's a ton of things with that. They'll give you some meds to slow it down, but they won't do anything to fix it. It's a big problem with the medical system in the United States, Canada, and Europe, is it's more of a sick care system than healthcare. They're more worried about just keeping you going, keeping you on pills, instead of fixing the underlying problem. So stem cells, we want to fix that problem. If we do an IV for your heart, it's going to go through your system. The first place it stops is the heart. We're consistently seeing patients where their ejection fraction was below normal. Normal is 55% or higher. We're seeing patients down as low as like 25, 30% that we're getting back within about 6 months to that 55 or higher range with the IV. It's incredible. We see the same thing with lungs. We see a lot of COPD patients, ARDS, fibromyalgia, and it's the same thing. We do an IV because heart first, then the lungs. The lungs act as a bit of a filter. 70% of the IV cells are going to get stuck there for 2 to 3 hours, and a lot are going to dissipate into the lungs, start repairing tissue and damage there. Then the rest will go through the system. And the rest that go through the system is why we treat things like kidney disease, why we treat liver diseases. So we're seeing patients in like stage 1, 2, or even 3 kidney failure do our IVs and improve their GFR, which is how you measure how well their kidneys are functioning. We're seeing patients with cirrhosis that are actually getting out of cirrhosis. Their liver starts functioning again, and they're getting good. Now, if it's caused by alcohol, we do ask they quit drinking. There's always diet and lifestyle factors to these treatments, but we've got something that can really fix it that modern medicine will tell you you're not supposed to be able to fix. So there we go. We've got joints, mainly for pain, nerve issues, those sort of things, number one. Then we've got autoimmune diseases. Then we've got your chronic degenerative issues. Those are the primary. And then later on, about 5 years ago, we got started into brain health. So it turns out if you get the cells to the brain, you can help people with stroke recovery, with traumatic brain injury recovery, which is general optimization of the brain. So what we do in those is we go into the lower back, and it's a really tiny needle. You actually sit like I am now, kind of hunched over, and we go into your lower back into what's called the thecal sac. This is the sac that goes around the spinal cord, and we go into that. All nerves get out of the way. You don't have to worry. You're not going to sever your spinal cord or anything. This is perfectly safe. Anesthesiologists and neurosurgeons do these sort of treatments every day on patients. It's very easy, very safe. It's a bit intimidating. It's not fun to do because mentally you think it's going to hurt. I've done it twice now over the past 4 years, and the second time wasn't any easier than the first. Even though I knew it wasn't going to hurt, you feel a little pinch, but it's such a tiny needle, barely bigger than an insulin needle. It goes in, take out a little bit of spinal cord fluid. That way we know we're in the space. And then we put in 2 milliliters of stem cells, which is 50 million mesenchymal stem cells, and 2 milliliters of what's called sodium lactate. Works really well, really great for people, and it starts fixing the brain. There's actually really great studies that show if you can get this sort of treatment within a year of having a stroke, so like around a 90% chance of full recovery, no side effect symptoms from the stroke. We've seen people with like Bell's palsy type paralysis of the face heal. We've seen paralysis of arms and legs go away from that. We've seen speech that was really deteriorating come back. So some really great results. And same thing with traumatic brain injury. Seen a lot of football players, MMA guys, just guys and girls that played sports when they're younger, got injured or even car wrecks, and we can help heal damage there because the stem cells work with the specialized immune system in the brain. It's mostly glial cells, which are these specialized macrophages that help get rid of waste. And it's a big neural network in there, a big electrical system. So you got to get rid of that waste so the electricity can flow, the communication can happen, and things work properly. The other thing we do, it's probably the fifth thing, but a bit less common, is we do for receding gums. Got a great dentist on staff, go into the gums, really easy injections, and we start seeing gums regenerate. We started doing this because we saw IV patients, a lot of them telling me that their gums that were receding were actually filling back in. Like, wow, that's incredible. So we started going direct to see if that would work better, and sure enough, it did. So that's just the quick list. And look, that took me 15 minutes to explain. So hopefully you stayed tuned, you got all this. But look, our website has all the info and more. You can go there. This is just a quick breakdown for people that don't know what stem cells are and what they can do. Hopefully this will help you understand. Our website has so much more info. And the best part is you can call me anytime. Toll free at 888-704-3977. Or you can check out the website at www.dreambody.clinic. I'm Josh, happy to help.